Hello, my name is Genesis Giselaria Ortega, and today I will talk to you about disorders of eating habits and behaviors among school students in Ecuador. Definition: eating disorders are behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associating distressing thoughts and emotions. They can be very serious conditions affecting physical, psychological, and social functions. Types of eating disorders include anorexia nervosa, bulimia nervosa, binge eating disorder, avoidance, restrictive food intake disorder, or specified feeding and eating disorder, pica, and rumination disorder. Risk factors for eating disorders. The factors are family history and genetics, anxiety disorders, life change and transitions, trauma, extracurricular activities, body dysactivation, being teased or bullied, low self-esteem, adverse image of the ideal body size, and alcoholism and associated physical changes.
Got 60 seconds? Take a mental health minute to learn about eating disorders. Eating disorders are serious and sometimes even fatal illnesses. Eating disorders affect all types of people. People with eating disorders may appear healthy even when they are very ill. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating. People with anorexia see themselves as overweight even when they are dangerously underweight. People with bulimia have recurring frequent episodes of eating unusually large amounts of food. They follow these episodes with unhealthy behaviors to compensate for the overeating. People with binge eating disorders feel a lack of control over eating large amounts of food, but don't purge, fast, or overexercise. As a result, they often are overweight or obese. The earlier treatment is started, the more effective it can be. Talk to a professional healthcare provider. Treatment is individualized, and a person may need more than one type of treatment. Learn more about eating disorders through the NIMH website and spread the word to help someone else.
Application in nutrition. Nutritionists help the patient about their current eating behaviors, and it is necessary to provide them with a weekly meal plan and accountability to help get them back on a normal eating program. Early detection and treatment can prevent future health problems and also reduce the risk of developing a severe eating disorder in the future.
The major treatment for eating disorders is psychotherapy or talk therapy. The goal of talk therapy is to establish normal, healthy eating patterns in a way to allow both the body and mind to function properly. Oftentimes, other medical physicians or psychiatrists are involved because there can be some complications during the course of treatment that require monitoring. There are a number of settings where eating disorders can be treated. Residential programs where patients stay for sometimes several weeks or several months offer 24-hour supervision and monitoring. On the other hand, office visits, which are typically done weekly, depending on the severity of the illness, is also common as well. Inpatient hospitalizations are sometimes used, but not as common as the other options mentioned. A newer approach is a day treatment program. In this setting, patients go home after treatment, and this allows patients to receive treatment in a less restrictive setting while maintaining the social contacts. Patients often feel in this setting there is less isolation. Regardless of the treatment setting that an eating disorder is treated in, it is very important that the team of specialists communicate and coordinate their efforts together to help combat the eating disorder.
Pros: early identification and treatment improvises the speed of recovery. Once all students were through in the resort, they revert quickly back to their real self. After treatment, they can feel freedom, strength, energy, self-acceptance, confidence, the love of food. Cons: eating disorders can affect physical, physiological, and social functions. Low self-esteem and a belief in their inability to perform. The student is less well withdrawn, emotionally down, unexpressed, disinterested in activities, antisocial, and incapable of concentration. The mortality rate for people with eating disorder is the highest of all psychiatric illnesses. It should apply in Ecuador. In Ecuador, the prevalence of eating disorder in adolescents is approximately 3.7%; in addition, 18.3% have a risk factor that increases the probability of suffering in. The age of risk of suffering an eating disorder in women is 50 years and in men 13 years.
Up and vice versa.
And for a teenager who is watching now, it is never too late, obviously, to get help. The right therapy is available. Speak to someone that you trust, to your parent, for example. This is an illness of denial, so parents need to keep that in mind. And get a good eating disorder treatment team, of course, together. It's more than just a mom or a dad. Call someone like yourself. And in fact, you have a book that is available. In fact, it's How to Be Eating Disorder Free in College. You can get it today for free for your
Conclusion: eating disorders are serious, potentially life-threatening mental and psychical illnesses. However, with appropriate treatment and a high level of personal commitment, recovery from eating disorder is achievable. The best type of treatment is one that is long-term and focused on needs of the person with the eating disorders and the family of cycle of support, with recovery as the ultimate goal. Thank you.